Hello and welcome back. So today we will start our lecture on cervical screening. We will discuss about the different methods which are used to screen for cervical cancer. We will discuss about HPV vaccine, what are the different types which are offered, which girls or women can have them. And then briefly we will discuss about colposcopy and then a few slides about cervical cancer. So cervical cancer in general, it's the fourth most common cancer in women globally. From country to country, it varies. But if you notice, over it's more common in countries which are socio-economically deprived. Okay, and there is a reason. So in these countries, because cervical screening is not either it's not performed or it's not accepted, even if it's available. So we need to understand the UAE statistics. In the United Arab Emirates, new cases they dropped from 2015, which were so 81 cases were reported, and in 2017 it was just 38. So remember that in in UAE there is a national register now. So whenever any kind of cancer is confirmed by biopsy, right? It's confirmed, then it needs to be reported. The only cancer which can be prevented by a vaccine. So why it is important? Cervical cancer is very important because it is can be prevented by a vaccine. So there is no vaccine for ovarian cancer, endometrial cancer. There is no cancer, no vaccine. So that's why. And what is that vaccine called? It's called HPV vaccine, human papilloma vaccine, because in most cases of cervical cancer, they are caused by human papilloma virus. We will discuss about the different types. Okay. So, but before that, we know that vaccines are mostly preventive, which means so we have to give vaccine before a condition is acquired or before a disease starts. But there are therapeutic types as well. For example, in many kinds of cancers, for example, bladder cancer, or even now research is underway to even develop a vaccine for HIV treatment. Okay, and many other diseases. So, but HPV vaccine is a preventive vaccine. Okay, to prevent cervical cancer. Now, what are the common types of vaccines related to HPV which are available commercially? So, first, when it was rolled out, it was called, the brand name is Cervarix. It covered only two kinds of HPV because HPV is a big family of vaccines. Some of them are called low risk, others are high risk. Okay, what do we mean by low risk and high risk? The low risk means are they do not cause cancer. Okay, so they have less chances of causing cancer. The high risk are the bad ones. Okay, so the Cervarix actually covered the two most common HPV types, which can cause cervical cancer and some other kinds of cancer. We will discuss about that. And the second type of vaccine, which is now very commonly used and preferred, that's called Gardasil 9. And why it is called 9? Because it covers 9 HPV types. Okay. So, and it includes both high risk and low risk strains. Okay. So, how effective it is? So, HPV vaccine is 90% effective in preventing HPV related cancers because it's not only cervical cancer. And some HPV types, the low risk types, can also cause genital warts. So, it can even prevent warts. It has a long lasting protection, and we are not sure yet. Studies show that maybe the effect of this vaccine, it may last at least for 10 years. We don't know. Okay, maybe longer, but we are not sure. So whether women can have or people can have, because HPV vaccine should be given to boys as well as girls, right? So whether these boys and girls should have a booster dose, we are not sure yet. Okay, so who can have it? The Center for Disease Control, it recommends that vaccination for boys and girls aged 11 to 12 years, even in the NHS. So all school girls and boys, they are offered HPV vaccine. and we will talk about how it works in the UAE. Catch-up vaccination for individuals up to age 26. So, but it's preferable to have as early as possible at a younger age, okay, 11 to 12. But if it is missed, right, then yes, they can have it up till preferably till 26. But how about those who missed even at 26, right? So women or men can still have up till the age of 45, but of course the benefit is minimal. So why it should be received at an early stage? Because at an early age, because it should be received preferably before being sexually active. Okay, so why? Because cervical cancer is related to sexual transmission, HPV, high risk HPV. Okay, it is not genetic. Cervical cancer is not genetic. Okay, unlike ovarian, for example, there is no genetic component. It's mostly related to sexual practices. So that's why the earlier it is received, the better it is. Now, one more thing, if we give HPV vaccine to kids under 15, they need 2 doses. But if someone receives HPV vaccination after the age of 15, they need to get 3 doses. Okay, and with age, especially even after being sexually active, yes, they can have it, but the benefit is much less compared to when they receive it at a younger age. Now, Dubai, Abu Dhabi, DOH, right? That's the Department of Health in Abu Dhabi. Previously, it was called HAD. So, since March 2008, free HPV vaccinations to schoolgirls in grade 11. So, this is the vaccination chart. You will learn more in pediatrics. So, it said that it's for HPV in grade 11. They should have it. Now, please note that in the UAE still, HPV vaccine is free only for local citizens, not for residents, not for expatriates. Okay, of course, kids can have it, but they have to pay for it. Okay, so in 2013, Abu Dhabi extended the free immunization scheme to include more Emirati women between the ages of 18 to 26. Okay, so they just extended up till the age of 26, but for locals, it's free. And initially, it was for girls. Okay, but because HPV can affect male as well, and apart from cervical cancer, it can cause other kinds of cancers, for example, even oropharyngeal or even rectal, depending on sexual practices. We have a slide coming up. So then, more recently, from the academic year 2023 to 24, it started to roll out free vaccines for boys from 13 to 14 years of age. It's free, of course, again, cost again for citizens. Okay. So, what causes cervical cancer? Now we know that most of cervical cancers, actually, cervical cancer, they are of two types. Squamous is the more common, and then adenocarcinoma. Okay, so which comes from the columnar epithelium. Anyways, so in all kinds of cervical cancers, 90% of cervical cancers, at least, HPV is linked to 90% of cervical cancers, other cancers in both men and women. And almost all cervical cancers, almost 99%, are linked to infection with high risk human papillomavirus. Okay. So that's caused by the high risk. Okay. Smoking, for example, also cigarette smoke can also increase, but like see majority HPV is just high risk HPV is linked to cervical cancer. Okay. Now, what are the different types of HPV? Okay, there are more than 150 strains, and they are broadly categorized into two groups: cutaneous, which means which involve the skin. And so in skin, you may have seen people having warts on the skin. They can be anywhere on the skin. They are benign, right? They are not cancerous. And then the other type is mucosal. In mucosal, there are two main categories: high risk and low risk types. So high risk, yes, of course, they can cause low grade abnormalities, but we are worried. Why do we call them high risk? Because they can cause high grade abnormalities. First, they can cause precancerous changes, and which can later develop into cancerous lesions, and that's why they are called high risk. They can cause various cancers, which we will talk about. And then the low risk type, right? The low risk type, they can cause papillomas in the respiratory or laryngeal respiratory tract or the larynx, low grade abnormalities of mucosal cells, genital warts like these, but they rarely become cancer. Okay, they are benign. So that's why they are called low risk types. Now, mucosal or genital HPV types are, okay, we said that, right? Further broken down into low and high risk types. And so basically, you need to remember only a few of these, okay? So you need to remember four names, okay? The high risk, they are 16 and 18, and the low risk, they are 6 and 11. At least remember these, okay? And the rest, there is a, because there are 150 types, right? You cannot, it's not possible to remember all of them. But 16, 18, 31, 33, HPV 42 are examples of high risk HPV. Okay, they are the more notorious ones, especially 16 and 18. Now, what kind of cancers, other kind of cancers are caused by them? Yes, we talked about cervical cancer in women. If based on sexual practices, it can cause oropharyngeal cancer, it can cause anal cancer, so especially homosexual men, okay, they are at high risk. Cancer of the vulva, penile cancer, and genital warts, right, which are the benign lesions. Now, I'll stop here, and then in the next part of the lecture, we will discuss what are the Ministry of Health in the UAE guidelines to screen for cervical cancer. If you have any questions,